India's healthcare system faces some of its toughest challenges in the area of accessibility and early diagnosis. Every single year, 38,000 children die from diseases that are entirely preventable with vaccines. Yet, 67% of children in rural areas still miss out on their critical immunization doses. And the problem doesn't stop there. Over one third of children suffer from malnutrition, and our healthcare infrastructure is overstressed. Where WHO recommends one doctor for every 1,000 people, but the reality is different in rural India. There is only one doctor available for more than 11,000 people, and the outbreaks of diseases often take more than 3 weeks to detect, giving infection their time to spread unchecked. And then comes the digital divide. Less than 15% of rural families have access to health apps, and nearly 287 million people are left behind just because they cannot read or write. This is the gap that Medicare, a WhatsApp-based AI chatbot, is designed to fill. Now let's see how it makes a real difference in healthcare.
With Medicare, we have made healthcare simple, fast, and accessible for everyone. Smart vaccination reminders, automatic scheduling, and reminders for children directly linked with local hospitals and available in the user's local language. AI medical imaging. Just send an X-ray photo on WhatsApp and receive an accurate diagnosis within 30 seconds. Personalized health schemes. Along with vaccination records, Medicare suggests personalized and relevant health schemes such as Ayushman Bharat. Outbreak protection. Tracks community symptoms and provides the government with early warnings for timely action. Malnutrition detection. Enter a child's weight, height, and MUAC and get an instant risk alert for severe malnutrition. Voice access. For the 280 million people who cannot use apps, Medicare provides voice-based assistance in 12 plus local languages. Central dashboard. A single platform where ASHA and Anganwadi workers can track active cases and access all relevant health knowledge. And all of this is possible on one platform, WhatsApp, which every Indian already uses. Now we will move on to the prototype demonstration.
Introducing Medicare, an AI health assistant chatbot built using WhatsApp API to make it accessible to 400 plus million users of the rural India. This is made from the test number, so let's dive into our Medicare. So if we say hi to our Medicare, then we get custom messages asking for what are the things that you need. This is multilingual support, so we can also type the same Namaste in Odia language. So if we type Namaste, then we can see that the chatbot has responded in same language. So now let's go back into our English. So if we type hi, then we can see that these are the top 5-6 features that our chatbot can provide. If we click on one, schedule child vaccination, then we can see that the chatbot is asking for the name. If we type name as Devanshu Jan, then we can see that the chatbot is asking for date of birth. If we write 15/1/2024 as our date of birth, then we can see that the Medicare has been scheduled our vaccination with the local nearest hospital, that is NIT KKR Health Center. We have also got information of the same, all the vaccinations scheduled for till 1 year at our email ID. So let's get into our mail. Now let's tackle another critical problem. 70% of rural India lacks access to radiologists. So let's select option number 2. Then we need to upload our X-ray. So let's upload the chest X-ray. Now the AI is analyzing this medical imaging using CV trained of 1000 X-rays. This takes 10 to 20 seconds, faster than human radiologist. Then now let's move to our next feature, which is detecting malnutrition. So we select option number 3 as child nutrition status. Then a mother simply enters her child basic requirements like first child's name, then child's gender, then child's age, weight, and height. After inputting this, our AI calculates the WHO growth standard Z score in real time. This calculation is accessed using the WHO data. If the child is suffering from severe acute malnutrition, which is the case of Priya in this case, then we give the trained all the protocols that they need to follow, and the most important feature is that we connect them with ASHA and Anganwadi workers. In this dashboard, we can see that ASHA and Anganwadi workers can see whether which child is suffering from SAM in their region, because government is supplying the supplements to them, and they can have the best use after knowing that which children are suffering from this. So we can have this all things on our dashboard. Outbreaks in rural India are often undetected for weeks. So our next feature is disease outbreak detection. So if we enter report disease symptoms, option number 4, then we can see that our Medicare is asking for when did symptoms start. So if we say yesterday, then it is asking for what are the particular things that we are suffering from. So if we enter fever, cough, and vomiting, then we get to see that it is asking for further details. Like if we have fever, then we say we have moderate fever. If we input the moderate fever, then we can see that it is asking for general location. So let's enter sector 7, Rohtak. Then we can see that the AI chatbot has analyzed all the details. It has analyzed whether the community health status is what, is there are any cases in our region, and what is the main feature. It sends the real-time data to the local health authorities so that they can take action if. So now our last feature is government schemes. So we select option number 5, then we can see that it is asking who is this for, like which schemes for whom we are asking for schemes. If we select we are asked for women and pregnant women, then it has showed that these are the available schemes. Now we wanted to check our eligibility, then we select option number 1. Then we can see that it is asking some general questions like, are you currently pregnant? So if we select yes, then we can see it is asking for, do you have BPL card? If we select no, we don't have BPL card, so option number 2, we don't have BPL card, then we can see that it has analyzed all the schemes that is available from our data, and these all are the available schemes. So this is very beneficial for the people who are unaware of schemes, and the condition can be improved with this.
And Dialflow to support 12 plus languages. For medical AI, transformer-based deep learning handles X-ray analysis. The backend runs on Node.js and Express.js with MongoDB as database. On the cloud, AWS ensures security and scalability.
And the impact of Medicare is transformative. It can save thousands of lives every year, reduce healthcare costs, and provide direct healthcare access to millions. And at the same time, vaccination coverage will also improve. And compared to existing urban app-based players like Apollo 247 or Tata 1mg, Medicare is WhatsApp first, voice-enabled, and truly accessible to rural and illiterate citizens. And that's our real edge. Thank you.